So we're going to do chapter 7. Chapters 7, 8, and 9 have a lot of overlap between them. We also trimmed down chapter 8 quite a bit from last semester and chapter 7, honestly. So they're much shorter than they were last semester if you're repeating. Which texture here is the most fragile? Curly. So, bone has 7 functions. Shape. I think I showed you guys like what I imagine we would look like without having any bones, right? Like that Pokemon Grimer. That Pokemon Grimer, or whatever his name is, where he's just like the big blob. So your bones are going to give your body its shape. Okay. Your bones are also going to give your body support. So it's going to hold up the weight of all of your organs and your spinal column and your skull and everything. Okay, shape and support, pretty simple. Protection. Bones are going to protect delicate internal organs. So for example, your chest, what organs are up here? Your heart. What else? Arguably some of the most important organs in your body, right? So it makes sense that you have this cage protecting them, that you have that rib cage to protect them. You have another cage up here. What's up here? Skull. What's inside your skull? Brain. Makes sense that you have another hard outer covering for it, right? So protection. Movement. Okay. So the analogy that I always use to describe it, right? You tie a rope to a plank, okay, and then you pull on the rope and the plank moves, right? In that analogy, the rope is the muscle, the plank is going to be the bones. The bones are the things moving. Okay, sometimes it doesn't immediately click why bones are involved in moving, but bones are the things that are moving. Okay. Electrolyte balance. So minerals like calcium and phosphorus. Okay. Calcium and phosphorus don't just get stuck in bones and stay there forever. If your body needs more calcium or it needs more phosphorus, whatever it might be, it has mechanisms to actually chew up the bone and release that back into your bloodstream. So it does participate in electrolyte balance. It also participates, it is the place for blood production. So including red blood cells, white blood cells, platelets, all of the components of blood. Okay, they're found in bone, they are made in bones. So a lot of people were asking me, "Go, wait a minute, what about like your lymph nodes or your thymus?" That's where like white blood cells are made. Technically, what happens is they get made in your bones and then they travel to like your thymus or to your lymph nodes and then mature there. Okay, but they get made in your bones originally. Last thing, acid-base balance. Bones are going to absorb and release alkaline salts to help maintain a stable pH. Okay, so to stay within that homeostasis, bones is helping out, or bones are helping out. Now, your bones are going to be classified based on their shape. Okay, it's really straightforward, I promise. Firstly, you have long bones. Okay, so something like your femur here. This is a long bone. It's long. That's it. Okay, long bones are long. Short bones. Short bones are as broad as they are tall, approximately. So we call them like cube shaped almost. Okay. So things like your wrists or some bones in your ankles, those are going to be short bones. They're like little cubes. Okay. Flat bones. Flat bones are flat. So for something like your forehead, okay, it's like a plate. So flat bones, flat. Your regular bones. Your regular bones are irregularly shaped. So something like your vertebrae. It has a whole bunch of different like wonky shapes coming off of it, so it doesn't really fit in the category of long bones or flash bones or short bones. Okay, it has a really weird shape to it, so it's an irregular. The last type of bone is called a sesamoid bone. Really, the only example that you guys need to know is your kneecap. Okay, sesamoid bones are just small bones embedded in tendons. Okay, like I said, the only example that you guys really need to know for that is patella, which is the word for kneecap. Okay, what shape are long bones?
Long.
What shape are short bones? What about flat bones? What about irregular? See, isn't that right? Promise. Okay. Tibia is considered what kind of bone? Long bone. All right, so really get to sneeze, but it's like not. Fine. What is the prefix epi mean? Good, it's good. Sorry. What is outer? Right? Outer. Okay. So starting with your epiphyseals. All right. Your epiphyses are going to be these little end caps to your bone here. Okay. That outer piece of your bone. The middle part, this middle bit here, this is going to be called your diaphyseus. I often call this the shaft, just because I think it's easier to say, and this is how I learned it, but it's the same thing. The diaphyseus is the shaft. Okay. Now, does anybody know what the word articulate means? So if I say the femur articulates with the tibia, what do they mean? What's it? Touches, right? What's the sign language be? So, articulate means to touch. Okay, so if I say that the femur articulates with the tibia, I mean that the femur is going to touch the tibia. All right. Now, when you look at these two bones, right? So this is going to be your tibia here. This is your femur. All right. I think this is actually like a right tibia. This is the left femur. This would be a right femur, and this is the left tibia. But generally, they kind of look like it. So we're just going to go with it. But the femur is going to rest on top of the tibia, right? And you see that there's points of contact right underneath the bottom of the tibia, or sorry, at the bottom of the femur and at the top of the tibia. Where those two bones are touching, you're going to find articular cartilage. So you have cartilage to protect the surfaces that are touching each other. Okay? Now they're not necessarily found on the end here, right? They're found where bones are touching each other. So the head of the femur, right? It goes into your hip. This whole cap here is going to be covered in articular cartilage. The tibia, you're going to have articular cartilage all down here. This is going to go into your ankle bones. Okay? It's just where two bones touch. It's just cartilage found. It's just where they touch. So it doesn't attach the two bones together. It just protects that piece of bone from the other one rubbing on it. A lot of times it is found in the end, but doesn't have to be in the end. Okay. Now, surrounding that whole bone, you have this membrane called your periosteum. There. Bones. Okay, so surrounding that bone, you have this membrane called your periosteum. It provides nutrients and it also provides some protection to the bone. So it surrounds the bone. Does anybody know what the prefix endo means? End. So your endo or endosteum is a membrane that lines the inside of your bone. Okay. And what it lines is something called the medullary cavity. So the medullary cavity is this hollow opening inside of your bone here. Okay. The inside of that is lined by the endosteum. Now your medullary cavity is going to be filled up with something called bone marrow. We're going to talk about more about bone marrow in a minute. But medullary cavity, hollow space. Okay. And it's filled with bone marrow. So there are different parts of the lung. Okay. I sent out the PowerPoint to you guys as well. Oh, okay. It should be in your emails from Friday. You should have 6, 7, and 8 already in there, and then I'll send you out 9 tonight. So you have that for Thursday. I think what we'll do on Thursday is 8 and 9. Okay, so that's all of this stuff written out for you guys. You like text better? Which of the following is not a function of bone? Regulation of blood glucose. What is this a function of? It is a negative feedback, but what organ controls that? Pancreas. What is the pancreas part of? Which one? There's 2 systems it's part of. The endocrine. There's another one. Digestive. Or digestive. It's there. You're on the right path. All right. Bone tissue is also called osseous tissue. Okay. As a general rule of thumb, if you see something that says osteo or looks kind of like osteo, it probably has something to do with bone. Okay, so osteo means bone. If it kind of looks like osteo, probably has to do with bone. Like ossification, building bone. Osteocytes, bone cells. Osteoporosis, disorder of bones that we're going to talk about. Osteoarthritis, a type of arthritis that has to do with bones. Osteosarcomas is a type of bone cancer. So osteo just means bone. Now, bone is a type of tissue that is really unique because of its matrix. Okay. Inside of its matrix, you can find a whole bunch of stuff. The things I want you guys to focus on: collagen fibers and crystalline salts, including calcium and phosphate. Okay. Because everybody tends to know that calcium is really important in your bones, right? But phosphate is also super, super important. All right. Bone is super strong. It has a strength rivaling steel and reinforced concrete. That's really, really strong, right? Bone is going to be highly resistant to stretching forces, aka tensile strength. Resistant to squeezing forces, so compressional strength, but it is not super resistant to twisting forces, so torsional strength. Okay? So, why is this important? Because a lot of the time you get bone, or not bone injury, fractures, right? That come from this twisting strength. So if you think about it, right? High impact injuries like car accidents and whatnot, yeah. I mean, if you put enough force on a bone, it's gonna break. But when you're just like running around and kicking a ball, you don't like break your bones from going like this normally, right? It's usually a combination of your body's moving one direction, your feet are staying the other, because of the twisting. Okay, the bone is not super resistant to twisting strength. Your twisting forces. Now looking at the bone marrow. So we just said the bone marrow is inside of what spot? Start with an M. Medullary cavity. Okay. So inside of your medullary cavity, you have bone marrow. Right. Now this bone marrow can be one of two types. All right. It can either be red marrow or it can be yellow marrow. Okay. So it can be red bone marrow or yellow bone marrow. Red bone marrow is going to make red blood cells. Okay. It also makes white blood cells and platelets, just makes blood cells, but red goes with red. Okay. Hope you remember. This is going to be what is in your body primarily in childhood. Okay. So red bone marrow is the bone marrow that you find primarily in childhood. So you can see a little infant skeleton here, right? He's all red. Yellow bone marrow over time, as you become an adult, right? Yellow bone marrow is going to replace that red bone marrow. Yellow bone marrow is like fatty, and it doesn't produce red blood cells. Okay, so does not produce red blood cells primarily in adults. Now, you still need to make red blood cells, white blood cells, and whatnot as an adult, right? So we still have red bone marrow. We just don't have it everywhere in our body. We have it in areas like our skull, our ribs, our vertebrae, our hips, the tops of our femurs, and the tops of the humerus. And when you donate red bone marrow, where do you donate from? Where do they stick the needle? Top of your hip, right here. And the reason for that, if you look at the way that the skeleton is set up, right? Most of the places that you find red bone marrow in adults, right? What do you have inside of your skull? Your brain. You don't want to be able to slip and you don't want to stab it in someone's brain. Same thing with the rib cage. What do you have in here? Heart, bones. You don't want to slip and have a needle go. Vertebrae. What's inside of your vertebral column? Spinal cord. Again, don't want to become paralyzed, right? But the hips, on the other hand, first of all, they're very easily accessible. Like you just have somebody curl on like their side in like a fetal position, and you can feel the top of their hips pretty easily. So it's easy to stick a needle in there. Secondly, like, yeah, you might like hit a nerve or something, but like it's not going to completely paralyze the person from the waist down if you mess up. So that's why when you do red marrow donation, you do it from this spot, but you do have red marrow as an adult in other areas. Now, there's a couple of different factors that can impact bone growth. Heredity. No, I don't have a spot for this on your notes, so don't worry. Just take a break from the take for a second. Heredity. Okay, obviously, like my dad is 6'4". It makes sense that I'm about his height, right? Like I'm pretty tall. Okay. My grandmother, on the other hand, she's 5'2". Heredity is not 1 for 1. It is not an exact science. Okay. So just because my dad's mom was short does not mean that he was short. Clearly. Okay. Nutrition is also very, very important, especially when it comes to things like calcium, phosphorus, and vitamin D. Does anybody remember where vitamin D is made? Where is vitamin D made? In your skin. It's the only vitamin that your body makes, and it is made in your skin. Okay, it is really important for bone growth. Hormones. There's a whole bunch of hormones that contribute. The main one that I would know, growth hormone. Growth hormone makes you grow. Makes sense, right? They got lazy with naming it. Exercise. We're going to talk about this when we get to osteoporosis as well. But it's like the whole use it or lose it mentality. Okay? Either you're walking around and your body goes, okay, we need to increase our bone density to accommodate this, or like at some point your body's like, we don't really need like these bone rates, right? So they start to break them down. Okay, so exercise is really important for bone growth. Now, bone remodeling is the process in which old bone cells bone cells destroy old bone and deposit new bone. Okay? So the process of destroying old bone is called resorption and depositing new bone, ossification. Okay? Now, remodeling is going to repair minor traumas and help contribute to homeostasis by releasing calcium into the blood. So like I said, once calcium gets into your bones, it does not stay there for the rest of your life. Sometimes your body needs a little bit more calcium for one reason or another. So you have to chew up some of that bone to release it. Okay. Now, maintenance of this balance is going to depend on work of both osteoclasts and osteoblasts. One of them builds, one of them destroys bone. Don't worry about knowing them. We're not having you guys learn those this semester. Okay. Now, because the bone adapts to withstand that physical stress, exercise can increase bone density. So meaning if you're taking regular walks, can help increase that bone density. If you are bedridden or you are not active, okay, it can promote bone loss.
Wait, so what can you recall that?
Exercise. And then lack of exercise promote bone loss. Okay, so sometimes your bones can degrade from more than just like lack of activity. Okay, sometimes there's a disease mechanism behind them. Osteoporosis is one of these times. What does osteo mean? Bone. Porosis, pores. Okay, literally means porous bone. So describe osteoporosis, you can put porous bone, you can put brittle bone disease, whichever works. Okay. Basically, what happens is these bones like hollow out on the inside and they break super, super easily. Okay. So something as minor as popping can cause a fracture.
You said they hollow,
They're not entirely hollow, but they're like less dense.
so they become real big.
Yes. So they're super, super brittle. You don't really notice until they start getting fractures. You see this a lot in like older individuals, I believe, who aren't like getting the proper nutrition that they need, stuff like that.
Yellow.
Yellow, right? Yellow bone marrow is predominant in adults. What type is predominant in kids? Red. What kind makes red blood cells? Red. What about white blood cells? Red. Yellow bone marrow is just like fatty bone marrow. Okay, so next we're going to talk about bone fractures. Okay, we have 5 different types of bone fractures. The first one is going to be a simple fracture. The simple fracture is just a fracture straight through. I think of it like breaking a chopstick. You just snap it, but it stays alive. Okay, so you can see it happens like in these thin bones here, right? You're not getting tissue damage around it. It's just like, oh, snap straight through. Bless you. Okay.
I think that's right. Can you describe it? What you mean different?
Just like snap.
Oh, no.
If you get like too hard of a kick to the side of your leg or whatever, it just breaks the bone straight through. Compound fractures. Compound fractures come through the skin. Okay. So compound fractures are going to happen in like really, really high force, like dropping on something. Because you need to like not only crack that bone, but push it out of the way. So like the example I always use when I worked in the ER, we had some guy that got a forklift dropped on him. So he had like compound fractures in his thigh, his entire pelvis was shattered. It was no bueno. But compound fracture comes through the skin. Okay. Because you have broken through the skin, there's an increased risk of infection with compound fractures. Because you are compromising that barrier. Same thing as like with third-degree burns, right? You compromise that barrier. So compound fractures have an increased risk of infection. Green stick fractures. How many of you guys go camping? Anybody ever gone camping? Okay. Do you pick up wood from the tree or do you pick it up from the ground? The ground. Okay, everybody looked at me like I'm crazy on the other class. Because if you pull like wood off of a tree, right, it just bends. It's very hard to get that stick to break so that you can put it into a fire. Green stick, because the inside of the stick is green. So that's why it's called a green stick fracture. Because when you try to break a twig on a live branch, it doesn't break all the way, it bends. Okay. So, green stick fractures happen in kids quite a bit because their bones are pretty bendable. So when like they snap, they might not snap all the way through because they have that like bending. Okay, so green stick fractures incomplete happen in kids a lot. Okay. Yeah.
How do they fix green stick? Not really.
They kind of stabilize it and let it heal on its own from what I understand. Because like you don't want to like aggravate it, but like yeah, I mean it doesn't really mean anything. From what I understand, I could be wrong. But like something like this, you gotta like push the bone back in and put like screws in and everything. So Okay, last few types. Conjugated. Conjugated fractures, a lot of people get confused with compound because they both start with CO. Or I guess COM, right? Yeah, COM. But conjugated fractures are like shattered. So whereas the compound fracture breaks through the skin, the conjugated fractures are like a shatter. This is going to happen in things like car accidents because like when you're driving, right? So if you're driving a car like this and you run into a wall or whatever, the force is going to go on your wrist and it's going to come into the ends of your bones here. Same thing with your femur. If you had your foot on the gas pedal, right, and you hit something, it's going to impact these parts of your legs where the force is being absorbed. Okay. But in order for that bone to shatter, you need an enormous amount of force. This isn't just going to happen from somebody kicking you in the leg hard. All right. So these are going to happen in high impact traumas like car accidents. Spiral fractures. Spiral fractures are when the bone is twisted around itself. So if you look at the femur, right, the head of the femur kind of goes to the side right here, right now. If it was a spiral fracture, okay, the head of the femur would twist and probably be facing kind of like this, right, or back, depending on what direction the fracture happens in. But basically, the bone end is jagged and it's no longer aligned the way it's supposed to be. Okay. So, summary. This should be pretty straightforward. We just talked about all these. The word bone a like the labeling one or like to fill in the blank?
The data was not.
Oh, we're gonna go through that in a second. So transfer is actually gonna be simple. So, green stick fracture, incomplete. You see how it doesn't go all the way through here? You see the right? It doesn't go all the way through the bone. Transverse, this is actually just simple. It's just also called transverse, but in this class, we just call it a simple part. Okay? Simple fractures go all the way through. Okay, but the bone still stays aligned. You can see the head of the femur is still in that nice clean, right? Conjugated, you see the shattering. Okay? Spiral, the head is going to twist. So what this is trying to show is that the head of the femur is twisted backwards. Okay? And then compound fractures, you've punctured through the skin. So it's pierced the skin. Now, when a fracture is repaired, there's a couple different steps to it. Okay? So the first thing that happens is you get a hematoma. What is a hematoma? Blood, but what do we call it when we're talking about the skin? A bruise. That's all it is. It's just a bruise on your bone. So first what happens is you get a hematoma forming. Okay? That hematoma is then going to turn into granulation tissue. Whenever you hear granulation tissue, just think healing tissue. There's a bunch of things inside of granulation tissue, like clotting factors, anti-inflammatory stuff, like granulation tissue is just healing tissue. Okay? It's a combination of a bunch of stuff that you guys don't need to worry about. Okay? Granulation tissue is then going to transform into a soft callus. So if you break your wrist, or if you've ever seen somebody that broke their wrist, right? First, it's going to swell up. It's going to be like a nice purpley black color. Okay? If you poke it like 3 days later, right? It's going to be stiff, but it doesn't like index, right? Because you have a soft callus form. That soft callus is eventually going to turn into a hard callus. So it's still going to be swollen, but it starts to get hard now. Okay? And eventually that hard callus is going to get replaced by bone. So remodeling is going to replace that callus with bone. Okay. So if you like pictures, I have pictures for this too. The first thing that happens when you break your bone, the hematoma forms, right? So those blood vessels burst and they release blood cells around the bone. Okay? Then fibrocartilage callus forms. We were talking about the soft callus forms from that. Okay? After the soft callus forms, the hard callus is going to form, and then eventually that bone is going to be redeposited there. But if you look, right? So originally the shape of the bone was pretty straight. Okay? When you look at it at the end, it kind of has like a lump coming out of it. Not as exaggerated as my drawing, but that's because your body learns. It's like, you know what, we should reinforce this so that this doesn't happen again. So sometimes you can still feel like a ridge whenever you break a bone years and years later. It's because your body is trying to be smart. It's trying to protect itself from the same thing happening again. Another graphic from your book. What type of fracture is most common in a car accident? Comminuted or muted. Okay. So you can see here, this is actually somebody's elbow. Okay, so you have your humerus here, you have your ulna here. So I presume what happened is they were driving and they hit their wheel and the force went into the back of their elbow here. Okay, you can see all that shattering down there. Ah, no. Which structure in both is responsible for producing red blood cells, white blood cells, and platelets? Red bone marrow. You guys are so smart. What type of bone is cube shaped? Short bone. What shape are long bones? Long. What shape are flat bones? What shape are irregular bones? See, bones are easy. Which process involves the continuous replacement and renewal of bone tissue? Bone remodeling, right? Ossification is just the process of making bones. Okay. So we're going to do a little bit in chapter 8. Then we'll go on break. And then I have an in-class activity for you guys. And then you'll be done. Well, done with me. Then you guys have to go take a test. Where's it going? Whoa, what is that? Okay, chapter 8, skeletal system. Okay, this chapter will warn you guys. It's a lot of pure memorization. So I would say make flashcards. If you're like doing the repetition over and over again, don't just read through the packet, say, I've got this, and then come to the exam. Okay, because this is just pure memorization. Okay, so in the adult skeleton, there are 206 bones total. Okay. Now your skeleton gets divided into two segments. You have your axial skeleton and your appendicular skeleton. Your axial skeleton is going to be that central supporting axis. It has 80 bones. So for saying briefly described, central supporting axis. Okay. All of the bones in white on this diagram. The reason why I don't include this diagram in the packet is because like you guys don't need the color, you know? And like if I put this in the packet, then we can be like, wait, what do I need brown? Let me try it. So the white parts, axial skeleton. Okay, so if you're going through and you're studying the bones and you're trying to remember which one belongs to which skeleton, you can always refer back to this diagram. Appendicular skeleton, there are going to be 126 bones in there. They're going to be the bones of your limbs, your pelvic, and your shoulder areas. So, appendages. Okay, so like your arms and your legs and whatnot. Okay. But that's why there's a giant space down here. So yeah, so the bones that are on the side, these are going to be the bones that you guys are responsible for the semester. We narrowed down the list quite a bit. Like there's some of them, yeah. Like the vertebral bodies, you guys need to know like the segments of. I think for the most part, it's all pretty much explicitly written out. Yeah. So for the facial bones, we took a lot of them out this semester and we focused on the bones that are most commonly fractured. Because these are probably the ones that you guys will come across from next. So that was the logic behind the bone that we picked. Okay. So the jawbone is going to be your mandible. Okay, somebody told me my first semester teaching here, the way that they remember mandible is because men have jaws. Okay, so mandible. So if that helps you, great. If it doesn't, don't worry about it. Other one, nasal bone. What is the nasal area? Your nose. Your nasal bones are just what makes up the top of your nose. The rest of this is all part of it. Okay? You have your mandible, you have your nasal bone here. Those are the two facial bones. Just know the rest of it as like the skull or the brain. Okay? Next, we have sinuses. We do still want you guys to know the sinuses because you guys are going to come across a lot of sinus infections, right? You're going to have a lot of people coming to you with questions as I did growing nose. So, sinuses are important. Okay? We have 4 sinuses we expect you guys to know. They are named based on the bone that they are embedded within. That's why they have the names they do. Okay? The first one is going to be your sphenoid sinus. It is found inside this bone that's like located on the inside of your skull here. Nice pretty butterfly shaped bone. Okay. So first you have your sphenoid sinus. Then you have your frontal sinus. What's your frontal region? Forehead. Your frontal sinuses are just in the top of your forehead. Ethmoid sinus. So ethmoid sinus, you have this bone at the top of your skull here called your ethmoid bone. Your ethmoid sinus is embedded inside of that. So it's the top of your nasal cavity. Okay. Lastly, you have your maxillary sinus. Maxillary sinuses are going to be these guys right here. Okay. So I've seen people do like the tapping on the faces to try and like help loosen up all this stuff. I don't know how effective it is, but that's the logic behind it, is that there's sinuses right here. Okay. What does the suffix itis mean? Inflammation. So if you have inflammation of your sinuses, what is it called? Sinusitis. That's it. Okay. So sinusitis is just a sinus infection. All right. So a lot of the time, you don't get sinusitis right off the bat. What happens is you get a cold, and then your like paranasal ducts get blocked up, they don't leak out. So that bacteria that gets inside of there starts to infect the linings of your sinuses, and they start to make excess mucus infection or excess mucus and inflamed sinus lining. Okay. So sinusitis is just a sinus infection.
Okay, let's see. I voted for other than farm.
The previous thing. Which one?
It was after French finance. Sorry, with the E.
Frontal sinus, maxillary sinus, the ethmoid sinus is at the top of the nose, and then the sphenoid sinus is right behind that. Okay. Next, you have your hyoid bone. Your hyoid bone is the only bone that does not articulate with any other bone. Okay. The whole point of the hyoid bone, it serves as an attachment point for a whole bunch of muscles that control your tongue, your jaw, your larynx. Okay. The only reason your hyoid bone should be fractured now, if you feel right, where you think of as your like Adam's apple, that's your larynx. Okay, you can see on this diagram your larynx is pretty far down here. Okay, your hyoid bone is like all the way tucked in and up here. All right, it should not be broken unless somebody has either punched you or strangled you. So, pathologists are going to look for fractured hyoid bones as a sign of strangulation. There's not really any other reason why your hyoid would be broken. So, the hyoid bone does not articulate with any other bone. So, for that true false, I believe it's kind of feeling like one. True. The hyoid bone is the only bone that does not articulate with any other bone. We're going to talk about the bones of the inner ear when we get there. Don't worry about it right now. B, 206. 206 bones in the body. Okay. Okay. So your spinal column has like 5 segments. Okay, I know there's 2 extra boxes on here at the top. Just ignore these. These are specialty vertebrae that you guys don't need to know. Okay, so for these 2 boxes on your packet here, don't worry about it. Okay. So your vertebral column, so your spinal column. Okay, and you have 5 sections to it. Cervical, where is your cervical region? Your neck. So you have 7 cervical vertebrae. Okay. So cervical is going to be in your neck region. You have 7 cervical vertebrae. Okay. Thoracic. You hear your ribcage called your thoracic cage sometimes. Remember, this is your thoracic cavity. We learned about our cavities, right? So your thoracic vertebrae are going to be the vertebrae that are attached to your ribs. Okay. You have 12 of these. So 12 thoracic vertebrae.
Okay, question.
Mm-hmm.
So diagram in the present. The first one would be cervical, vertebrae, the second is correct, that by that book.
No, the reflux is a vertigo.
Oh,
So cervical, thoracic. Yeah, so you can probably that entire. We had everyone learning like the names of sigma and six of the first two vertebrae last semester. We're just not the academic semester, so the black and white diagram. So cervical, neck, thoracic, chest area, rib cage, lumbar. Lumbar region is lower back, right? You have 5 lumbar vertebrae. Okay. Now you have your sacral region. Your sacrum is going to be consisting of 5 fused vertebrae. So there are 5 vertebrae that are all together. So 5 fused. Okay. And lastly, you have what's called your coccyx, which is made up of 4 fused vertebrae. The coccyx is what people think of as your like butt bone. It's like the leftover from whenever we had tails. It all got merged into this little tiny structure like this big here. Okay. Now you have, so when we talk about the different vertebrae, right, you're going to hear them saying things like, oh, their L4 vertebrae has a crack in it, right? The way that the vertebrae get named, first letter of the section, and then the number. So L4, 4th lumbar vertebrae. C2, 2nd cervical. So on and so forth, okay? So just in case you guys see that terminology coming out, that's why. You have 2 normal curvatures of your spine, okay? They're called kyphosis and lordosis. Kyphosis, lordosis. Now, if you look, right, the spine doesn't have like a perfectly straight structure, okay? It's going to curve both in and out and in. Obviously not dramatically, but you get the point, okay? The direction that it's curving is called kyphosis or lordosis. You guys won't need to know like which one's which. But kyphosis basically curves out, lordosis is curving in. Okay. And like I said, these are perfectly normal. These should be there. Okay. So you have this, and then this, and then this, right? This is kyphosis, lordosis. All right. Completely normal. Now, what is abnormal is something called scoliosis. Okay. So if you're looking at somebody from this way, right? So you're looking from a side view at me. It is completely normal for my back to be curving like this. Okay. But if I turn backwards and you're looking at my spine should look pretty straight. So I don't know if you guys had to do the checks during gym class, right? Where they're like trying to like bend over and touch their toes and they look at the spine. This is what they're looking for. They're seeing if your spine is curving side to side. Okay. Scoliosis is an S-shaped curve, but very specifically from side to side. Because it is normal for your back to curve like this when you're standing to the side, or if you're looking to the side. Okay, so this is when you're looking at somebody's back. So scoliosis, S-shaped curvature. Now, your spine is curved for a couple different reasons. One, it gives you better shock absorption. Okay, so those natural curves are going to act like springs, and it helps to distribute that mechanical stress when you're walking, or jumping, or running, or whatever it might be. Okay. The other thing it does, increase flexibility and range of motion. Okay. It is also going to help you enhance stability and balance. So rather than, I'm trying to think of a good analogy, bless you, but I can't off the top of my head. But basically, like it helps accommodate like wind better, right? Like if you're sitting as a board, you get to like a wind blow by and you just get knocked over, right? Having that nice little curve helps you accommodate for that. Improved support for your internal organs. So improved support, right? It's going to help create space and protect those vital organs that are down in your chest and your abdominal cavity in particular. Okay.
Stability.
For this one?
Stability.
Stability and balance. Yeah, go on. We'll finish up the spine. We'll be done. So for your vertebrae, okay. There's a whole bunch of things listed on here. Really, I want you guys to focus on knowing your vertebral foramen. Okay. Vertebral foramen is just going to be this hole in the back here. Okay. This is where your spinal cord runs through. Now, the reason I always point this out, because when I like started college, right? I don't know if I was just like not putting two to two together. Okay, but if you like look at the spinal cord, right, or the spinal column, okay, it does this kind of thing. Okay, and then you have like your spinal bodies here or whatever. Okay. I always thought that the spinal cord ran through this thick part here. Like I thought it was all just, I don't know, magically going through the bone. It does not. It runs through this vertebral foramen found at the back of the vertebrae. Okay. And this part here, this is going to be your body. This is where the weight bearing portion of the vertebrae is. And the reason I don't have you guys labeling it is because we're going to talk about herniated discs. And the labeling tends to get confusing when you have the parts of the cartilage as well as the body. But I wish I had the physical model. Check it. Because I don't want to bother them because they're taking the test. So I don't want to go in there to be like, hey, can I steal this?
So where that's a spinal cord path through the vertebrae. It's the openings that allow the passage of the spinal cord.
It's the vertebral foramen. So it passes through the vertebral foramen.
But
Okay, so if we look here, right? It's gonna be hard to do without somebody. Okay, well, it's not letting me hide it super easily, so I guess we can just look at the lumbar section. Okay, so if we look here, for example, right? You see how there's this thick portion here? This is the body of your vertebrae, okay? So this is where like that cartilage is. Your vertebral foramen is like right here. Okay, so your vertebral foramen is just a bunch of series of holes that your spinal cord is going to run through in the back. Okay, this part of your spinal cord bears the weight. And the reason why that's important is when it comes to talking about herniated discs. Okay. So if we look at like a side for a top view of this. Right, so we're looking at the top view of that vertebrae. You can see it's literally the one that we just showed you a picture of. Okay, so this thick part here, that's going to be your body. All right, and then you have a hole back here, that's going to be where your spinal cord runs through. Now, don't worry about knowing the rest of these pieces. When we talk about intervertebral discs, okay, we have cartilage running in between each of our vertebrae. Okay. They have two parts to them. They have what's called the nucleus pulpus and the annulus fibrosus. The way that I like to think about them is like thumbprint cookies. Okay. So the outer part, that annulus fibrosus, it even sounds like it's fibrous, it's hard, right? It's like the hard outer part of the thumbprint cookies, whereas the nucleus pulpus is that like gooey jelly inner cell, the center, right? So that's really going to be helping absorb that impact in between the two. Okay. In a herniated disc, what happens is some sort of force pushes these two vertebrae like right on top of each other. Okay. And it causes that annulus fibrosus to crack. And that gooey part, that nucleus pulpus, starts to kind of ooze out. Okay? So can cause the annulus of the disc to crack. And when this happens, the nucleus pulpus oozes out. Okay? Now what that basically does is it deflates the space in between the two vertebrae. Right? And you have these things called spinal nerves coming out in between your vertebrae. All right, and they want to have that nice cushion space around them. But when your herniated disc happens, right, and you deflate that space that's in between the two vertebrae, they're going to start to squish down on these spinal nerves. And that's what's going to cause all that back pain. So when you have a lot of weight and force pushing down on those vertebral columns, they can lead to these herniated discs, which are going to pinch nerves in your back. So that's why herniated discs are super painful. Okay. So we will go on break. So come back at 5:22. Then I have an in-class packet for you guys to work on from chapter 6 and 7. And then I'll check that, and you guys will be free for the day. Well, from me. And then you guys have to go take your test. Okay, so 5:22.